Assalamu alaikum guys. Today's our topic is axillary and musculocutaneous nerve. Axillary nerve. It originates from posterior brachial plexus. Course, it leaves the axilla and passes through quadrangular space, enters the posterior scapular region. It supplies deltoid muscle, teres minor, skin over inferior part of deltoid muscle. Musculocutaneous nerve. It originates from lateral brachial plexus. It leaves axilla and pierces the coracobrachialis muscle, enters the arm, descends between bicep and brachialis, supply all three muscles of anterior compartment of arm. In the forearm, proximal the cubital fossa, it pierces the deep fascia and become. Today we are discussing about radial nerve. Origin. It arises from posterior brachial plexus. It leaves the axilla and pass into posterior compartment of arm. Here it lies in radial groove of humerus in close contact with bone. Then it pierces the lateral intermuscular septum and enters the anterior compartment of arm. Branches in axilla. Posterior cutaneous nerve of arm, which supplies skin on the back of arm down as far as elbow. Nerve to the long and medial head of tricep. Branches in radial groove. Lower lateral cutaneous nerve of arm. Supplies skin over lateral surface of arm. Posterior cutaneous nerve of forearm. Supplies skin down the middle of back of the forearm as far as wrist. Nerve to unconeus. Branches in anterior compartment of arm. Nerve to brachialis. Nerve to brachioradialis. Nerve to extensor carpi radialis longus. The nerve enter the forearm anterior to the lateral epicondyle. In cubital fossa, nerve divides into superficial and deep branches. Deep branch supply all the muscles of posterior compartment of forearm. Superficial passes in hand. Supply skin over dorsolateral surface of hand and dorsal surface of lateral 3½ finger as far as proximal phalanx and skin over thumb. Here is mnemonic to remember innervation and action of radial nerve. If you like the video, subscribe my channel. Allah Hafiz. Stay tuned for more. Assalamu alaikum guys. Today we are discussing about ulnar nerve. Origin. Ulnar nerve originate from medial brachial plexus. It leaves the axilla and enters the arm. In the middle of the arm, it pierces the medial intermuscular septum and enters into posterior compartment of arm. It passes behind the medial epicondyle of humerus. It gives no branches in axilla and arm. It descends in the forearm and leaves the forearm by passing superficial to the flexor retinaculum. In the forearm, it supplies the flexor carpi ulnaris and medial half of the flexor digitorum profundus. Ulnar nerve enter in the hand lateral to the pisiformis and divide into a superficial branch which is mainly sensory. Supplies skin of 1½ finger on palmar and dorsal surfaces. And a deep branch which is motor supplies all the small muscles of hand except thinner muscles and first to lumbricals.
Assalamu alaikum guys, today we are going to discuss median nerve. Origin. Median nerve originate from lateral and medial cord of brachial plexus. Course. It leaves the axilla and enters the anterior compartment of arm, where first it lies lateral to the brachial artery, and then come medial to it in lower half of arm. It then pass anterior to the elbow and enter into anterior compartment of forearm. It leaves the cubital fossa by passing between two heads of pronator teres muscle. Descend downward and enter into carpal tunnel in the distal part of forearm. Branches in arm. Anterior interosseous branch. Supplies all the muscle of forearm, except flexor carpi ulnaris and medial. Half of flexor digitorum profundus. A palmar cutaneous branch. It supplies the skin on lateral side of palm. Median nerve then enter into hand by passing through carpal tunnel and divide into recurrent branch and palmar digital branch. In the palm, median nerve supplies muscle of thenar compartment and first to lumbricus and skin of the palmar surface of the lateral 3½ fingers, including the nerve beds on the dorsum of the hand. If you like this video, subscribe and follow for more.